On the Health Watch, RSV cases are on the rise, sending many children to Chicago area hospitals.
And the virus can lead to very serious illness, especially among young babies. So what can you do to protect your family this season? We're going to dig into that this morning with Dr. Julie Holland, Vice President of Pediatric Primary Care at Advocate Children's Hospital. Dr. Holland, first, good morning, and thanks for being with us.
Good morning.
This is at the top of mind for so many families, whether it's just the common cold or you're worried about it being something more serious. Why are we seeing these RSV and flu numbers rise, and how are they spreading most common right now?
Well, unfortunately, we see this RSV and flu rise almost every year. You know, these are seasonal viruses. They tend to peak in the winter, and we're seeing what is a pretty typical rise now. The issue with RSV, which stands for respiratory syncytial virus, is that for a lot of little kids, it gets into their lungs and causes inflammation, difficulty breathing, wheezing, and puts a lot of them in the hospital. So we want to try and avoid being around people that are sick. That's your main strategy is, try not to expose your kids to other sick people. But we also have some effective prevention strategies with vaccines for flu and also for COVID, which we're starting to see a little bit more of. RSV, we were really hopeful this year we would have a great monoclonal antibody. Unfortunately, it's in short supply, which means that most kids are probably still going to get RSV at some point in their first 2 years of life. The goal eventually will be to prevent all RSV with this monoclonal antibody for babies. And we actually have a new vaccine out for RSV for pregnant women and for older folks who can get sick as well.
Well, what might surprise parents about RSV and the flu? Of course, they think about it. They've probably had discussions about it, talked about vaccines. What do you think is something that they say, oh, I didn't know that, when they come to you and ask about it?
Well, the bad news is that there are over 80,000 hospitalizations in babies a year for RSV. I think most parents whose kids get sick don't realize how quickly their kids can get even sicker and wind up in the hospital. And that's true for both RSV and flu. It really strikes the youngest kids under 1 or 2 years of age. It's a very serious illness in those kids. So most parents will know somebody whose baby's been hospitalized because of RSV. 1 to 2% of all infants get hospitalized from RSV. It's a really serious infection. And so people need to realize that these aren't just common colds. These are infections that can cause not only severe breathing problems from the infection itself, but then we see a lot of other things after that. We see a lot of pneumonias that happen after RSV or flu or ear infections. So lots of illnesses result from these viruses.
So then what's your number one advice to parents who are watching, saying, I really want to keep my kids healthy this holiday season? What should I be looking out for? What should I do?
So number one thing to do is get vaccinated when you can. Flu vaccines are available now everywhere, so get those done. Everybody who's 6 months and older is eligible for that. So that's number one. I would say I would add the COVID vaccine to that as well. For RSV, you want to minimize exposure. So if you're going to Thanksgiving, it's a good idea to ask everybody to not bring sick family members. You don't want to get other people sick. You don't want other people to get your children sick. And then all the other things you can do. Good hand washing is key. Covering your mouth and nose when you cough, wiping down surfaces that people have coughed or sneezed on. Those are all ways to prevent infection. But the best way is vaccination and staying away from sick people.
All right, I know it's so much more difficult during the holidays. Everyone's getting together. So it's just such a good reminder, if you're sick, to just stay away from people. Dr. Julie Holland, Vice President of Pediatric Primary Care at Advocate Children's Hospital. We so appreciate your expertise and your time this morning.
You're very welcome. Happy Thanksgiving.
Happy Thanksgiving. Thanks for being with us.